I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor. Welcome to another episode of Women's Health Unplugged. I'm Dr. Jordan Robertson. I'm a naturopathic doctor, and today I've been joined by one of my colleagues, Dr. Rachel Corradetti-Sargent. Rachel, thank you so much for joining me on the podcast today.
Thanks for having me.
I'm going to let you partly introduce yourself because, which I always do, I always want my guests to kind of walk us through their story and their path of getting to where they are in their career, because I think that story is so important. But the reason that I've had you on the show today, and what I think we're going to have a great conversation about, because you and I both have spent a lot of time on this topic, not just professionally, but personally. So we're going to talk about the concept of preconception care and how women can optimize their health as it pertains to their fertility. I would love if you could kind of walk us through, I know you've got such a great story about this and you've been really open in sharing with women, which gives them a lot of hope, I really think. Can you just let us in on that story and help us understand how you got to this point of being the preconception naturopath that you are?
Sure thing. It's interesting because when I look back, hindsight is 2020, I see that really every step of my journey through university up until my naturopathic training and to being here today, it was all connected to this. And so a lot of it comes down to my own journey with my health, specifically my hormonal imbalances and my own difficulties conceiving and maintaining pregnancies. So I always knew in the back of my mind that I might have trouble getting pregnant. I even remember having this thought when I was in my teenage years because my mother experienced multiple miscarriages, and I was very aware of that because I was around her. And so, when you're in your teens, you're not really thinking too much about this. I wasn't thinking too much about the acne that I had and the contraceptive I was taking to manage it and that type of thing. But when I got to university, this is when it all started to unravel because I came off the pill, and a year later, I still didn't have a period. So I went to the medical doctor at Western, which is where I was attending university in Ontario. And he said, "You have a lazy ovary. You're going to have a really hard time getting pregnant when you're older." And this conversation was so pivotal in my, early 20s, because here I was having this thought that I'd had all my life coming to fruition. Oh my gosh, I'm going to have trouble getting pregnant. Do I even want to become pregnant? And so I kind of went on this journey of, okay, what am I going to do? And how is this going to affect me long term? And so I started working with a naturopathic doctor in London, Ontario, who helped me get my period back in 3 months, of course. It was all fine. And after that, I thought, okay, everything's going to be A-okay. This is not a big deal. I don't have to worry about it. And then it all started to unravel again after my wedding. So I was married in 2014. I had just launched my first clinic with a colleague. Things were pretty stressful. There was a lot going on behind the scenes with my family. There had been a number of deaths in my immediate family. We had also had to close our family business. So things were really stressful. And so after my wedding, I fell into a pretty deep depression, and things were starting to not work out business-wise. My husband lost his job, and then I got pregnant. And I thought, okay, this is the silver lining. I can totally get pregnant. This isn't an issue. And then sadly, I started to miscarry just a few days later. And it turned out that it was an ectopic pregnancy. So this is something that both my mother, my aunt, and my grandmother had all experienced too. So, something was going on here that needed to be looked at a little bit more deeply. And so after that time, I decided, okay, enough is enough. I need to get really focused on how I'm taking care of myself in order to make this happen. I want children. I want this to be a part of my life. What are we going to do? So I was working actually with a naturopathic doctor who's fertility focused at the time to help me unravel the issues that were going on for me. And so I really dedicated myself to cleaning out my diet, figuring out my cycles, using the proper herbal botanical medicines to help. And it took some time, and there were a few chemical pregnancies along the way, but it happened. I got pregnant with my daughter, and here we go. The pregnancy was fraught with difficulties, really right from the beginning. My integrated prenatal screening revealed that I had low PAP-A, which means basically that I could miscarry at any time, or the baby could be born very early, or the baby could be very, very small. Plus, it gave me a much higher chance of developing preeclampsia. So I was lucky in the sense that I made it to 38 weeks, but on that day when they assessed me, she had stopped growing about 2 weeks prior, and they sent me for an induction. So I went for my induction, and then they discovered that I was preeclamptic, and I had the early stages of HELLP syndrome going on. So my liver was essentially breaking down, and my blood pressure was just crazy high. I had no idea. I had no symptoms. It was the most bizarre thing. So thankfully she was okay, although quite small, and I was okay afterward. And she's a little force to be reckoned with now. But after that pregnancy, I thought to myself, my goodness, I guess I didn't go deep enough with my preconception care. Let's try this again. I'd like to try to have another baby again. God willing, this will be okay for me to have this happen. And so that's when I started to actually really get serious about looking into subclinical hypothyroidism that I had pretty much ignored for years. I got real about my own AMH value, which was a 3 when tested in my early 30s. That's a little scary. And so for about a year, I did everything I possibly could to conceive my son. And it happened on the first try, and it was the easiest pregnancy. So I thought, okay, it worked. And that's really when the magic little light bulb went on for me. And I was like, this is it. Why isn't everyone doing this? I understand that I have a lot of strange things going on for me, but lots of people are in my position. This makes so much sense. This has to happen for everybody. So it was really at that time that my son was born. I was leaving my Toronto practice. We were moving outside of the city, and the opportunity for a fertility focused practice really fell into my lap. And I just dove head first into it. And that brings me to today with you here.
Wow, that's such an amazing story. I love when clinicians have this like sort of personal connection to what they do, right? Because I think you can just see the role that you can play with those women, the hope that you can bring to those women, but also like the empathy that you can have for women that are in the same shoes that you were in. That's such a like powerful way to be able to show up for those women and those couples.
Yes, absolutely. It's really, I don't want to say rewarding, but I'm so empathetic to somebody who is sitting with me and going through the difficulties. My story is, never the same as anyone else's, but at least I've walked perhaps a portion here or there. And so it brings me joy to be able to help someone on their journey so that they don't feel alone.
But this isn't like a conventional way of approaching fertility and just making babies in general, is it?
No, definitely not. The whole topic of preconception care is something that isn't really ever discussed with anyone. I find, the conversation that I had even with my own medical doctor when she told me, okay, Rachel, you got to start thinking about babies. That was it. We didn't talk about the things that could impact that. What's going on with diet, what's going on with hormones, what's going on with nutrient levels, environmental toxins, and all the types of things that could really impact somebody's ability to conceive.
And it's interesting, I think our generation of women, or now the younger generation coming up underneath me, because now I think I'm almost in the next generation of women, but really like their planning around not having a baby is impeccable, right? The options that are available to them to support themselves to have contraception is impeccable. But we don't think about the planning side of things for like the actual having of the baby, right? Or the actual fertility side of things, which I find so difficult, right? We know that women are delaying childbearing for later in their years just based on like professional education and all the things that women want to accomplish before they're ready to have children. We're doing all these things to sort of delay this conversation. And then I think we have this expectation when we're ready that it's just going to flick a switch and things will be fine because women had spent 15 or 20 years trying to avoid having a baby.
Right. And really turning off maybe the hormonal messages that their body was trying to send them if there were issues. And the reason why they were using contraception was to control those issues. Right. So that's another element of it. I was, thinking about preparing for today, and there's a line that I am borrowing from one of my colleagues, whereby she says, you want to plan for your pregnancy the way that you would plan for your wedding. So a lot of women spend a lot of time planning their weddings. I spent 2 years planning mine. And then when it comes to having a baby, whether or not that involves a wedding, who knows? But you don't think about it as much. You expect that the eggs are just going to be ready to go and that everything's going to work out. And we don't really think about it until maybe we're 6 months to a year later and it's not happening.
That's right. It's funny. I tell this story often, but so many women don't even realize or know that their eggs are actually with them from the beginning, right? Which I find just like this most beautiful and fascinating part of female physiology, that like the moment, or maybe not the moment, but right around the moment that women are conceived as babies, right? They have their eggs with them from that moment onward, which is something that my daughter knows, right? So my daughter's 9, and I've told this story before. I think I've even told it on the podcast before, where my daughter at the time when she was 6 actually told her teacher that her eggs were in her, right? And pointed to her abdomen, and she said, my eggs are all in there. And her teacher said, no, they're not, Charlie. And she came home and she said, Mommy, did you know that Mrs. So-and-so doesn't know that her eggs were in there the whole time? And I thought, it was fascinating to me that her teacher didn't know, but also that my daughter knew it so deeply that she wasn't even going to be swayed by this adult who tried to convince her that they weren't in there. But this isn't something that women are aware of, right? Like that their eggs are in there and they are living with us through our binge drinking university years. They're living with us through our experimental smoking years. They are living with us through our, right? Like they're in there that whole time. And then at 34, when we've made that decision that we're ready to try and conceive, like you said, we just expect them to be there. We expect to be able to rely on that part of our anatomy when we maybe haven't nourished it all the way along, or even thought about it all the way along.
Right. Or have only thought about it in the way of trying to just avoid it altogether.
Yeah.
I even recall having conversations with patients in my Toronto practice when I was there, with 35-year-old women. And have you just so I know you're here for a different reason, but just so I know, are you thinking at all about having children in your future? And then I'm saying, I haven't even thought about it. And me going, oh no, public service announcement. Let's think about it, please. Right? Because this is not an infinite well of possibilities here. We eventually will run out.
Yes. Yeah. And I think with all the technology options that are available to women right now, women do have more potential for them to delay the actual pregnancy part of their fertility care, but the egg part is a conversation we need to be having much earlier in their whole journey.
Absolutely. And that's really
embryo transfer or frozen eggs and cryopreservation. This isn't something that existed, 15 years ago. And so they have these beautiful possibilities as far as delaying the actual baby part. But I'm not sure we're having that conversation early enough around egg quality and preconception care with women to even help them make an educated decision about that.
Right. And so much of the egg quality conversation comes down to what you're doing at a preconception level. So in my preconception work, we're aiming for at least 100 days to get those eggs in optimal shape, because that's really what it takes. And so if you think back, that's about 3 to 4 months really that we're looking at, where at the very least we should be making some changes at that point. But I've certainly in my clinical work see it take much longer for things to improve too.
So walk us through what preconception care means and what that looks like. And so, you kind of alluded to that there's maybe things in a woman's past that actually may put her at risk for struggling with fertility care at a later time. So maybe even just highlighting some of those things, like how do women even know if they need to focus on preconception care? Why don't we start there and then we can kind of dive into some of the things that women can actually do. How do women know if they need preconception care? I mean, aside from everyone needing it, because I think we're going to loop back to the fact that probably everybody needs it, but are there red flags that you're looking for in your women's history to help them understand this better?
Definitely. Yes. So, one thing for sure is if there have been issues with their cycle after menarche, so after the period started, sometime in their early to late teen years, whenever it may be. Late teen years, of course, tells us there may have been a problem already. So I'm asking questions about whether their cycles were irregular or whether the cycles were painful, whether they were very heavy. Did you have to take time off of school? Were you sick to your stomach? Did you use an oral contraceptive or a contraceptive of some kind? And was the reason for that because you were trying to fix a problem with your period? I remember being in high school, and my closest girlfriends and I were all on the pill because we had acne. Right? So, I mean, there's a time and a place for contraception. There's no question about it. But, that obviously indicates that there's something going on. So I'll start with those types of questions. I think also an awareness of family history can help to a degree, right? If, for example, mom went through really early menopause, it's not always indicative of a problem for the woman trying to conceive, but it can be helpful information for us to understand for sure. So, if those situations are continuing into their 20s and into their 30s when they're trying to conceive, if the cycles are very irregular, for example, or if they're starting to get abnormal symptoms for a female, whereby they might be starting to grow hair along the chin or the jawline, if they're starting to lose hair on their head, if they're starting to see hair growth on the chest or the abdomen. So some of these things can tell us, that there's something going on here that's not right. And if you want to become pregnant, we're going to have to figure out what exactly is going on here. So those types of people are definitely going to be in need of preconception care for sure.
It's interesting because so many women, I don't think even remember why they went on the pill. That's a common question that I will ask my women too. I'll say, did you go on the pill for contraception or for something else? Right. And quite often they're like, well, no, it wasn't for contraception, because they know that they were 15 or 16 or even younger. They're like, no, it wasn't for contraception. They're like, I don't really know why I went on the pill. Right. And then they're trying to remember like what it was like to have those periods before. And often don't recall, right? Because like you said, like we're using the pill, and again, not wrong, because for lots of young women, that's getting pregnant during those years is a huge risk to her health, right? Of course, we want to avoid pregnancy during that time, but there isn't that like knowledge piece there around how come we're on the pill, which is such a important piece to communicate to the person involved in your fertility care, because it helps us understand your needs. It helps us maybe predict how aggressive we need to be with fertility care, and even risk of miscarriage, which has always been my sort of personal angle to approach this whole issue, that we often wait until women have had miscarriages before we get curious about their case. We see some miscarriages we can see coming a mile away, right? Just be given a woman's history and given what we know about them, but we're just not always asking all those questions.
Definitely. And it's interesting because there's a level of denial with it too. And in patients that I have had where we've had conversations about preconception care because they're very forward thinking ladies. If we do some blood work and we see there might be an issue with something going on with the thyroid, there might be some thyroid antibodies, trying to have that conversation, like there's a problem here, this is going to cause problems. Sometimes they can't even wrap their heads around it because it's such a foreign thing, right? Mm-hmm. So yeah, it is often a situation whereby we're seeing people after they've been through these great traumas because they can't even really fathom what that would be like beforehand.
Mm-hmm. And certainly conventionally, and I love the title of, you have some great resources online for women who are starting to get curious about their preconception care. But even the title of one of your resources is you don't have to wait a year. Like, where does that come from, that title?
Well, so really, when you're trying to conceive, it can take about a year. It can take upwards of a year for you to conceive. That's considered normal. So at that point, that's typically when there will be some investigation done. So the idea behind you don't have to wait a year is, let's think about this ahead of time. If you're thinking about becoming pregnant, here are the things that you can do. If you're already actively trying to conceive, and let's say it's been 6 months and you're still not having anything happen just yet, what are some things that we can do to get things moving in the right direction, to assess where you're at and understand where we need to affect change?
I love that sort of proactive approach. And it's that sort of, same idea that you're saying there around the denial, right? Like we've got couples at home, isolated, not having this conversation, who have maybe some barriers to their fertility that aren't even aware of it. But yet, because conventionally we let them, I would say, be in the wild trying to have a baby without having that conversation, we're also just letting that couple age a year without them getting maybe the support that they need or the tests that they need or whatnot. Can you walk us through what like a typical assessment would look like tests wise? So if a woman comes and says, I'm curious about my preconception health, I'd like to plan my wedding or plan for, to try and fall pregnant over the next year. Are there some blood tests that are like imperative for women to have done? To help them understand their preconception needs?
Yes, definitely. So I will probably be a little bit more thorough, I'll use that word, thorough, than maybe is always necessary for patients, but it's because I've seen so many issues crop up too late. And they're too far along for us to be able to correct them. So initially, I really want to have an understanding of what's going on with their cycle. And at that point, I'm generally very curious about doing some cycle timed blood work. So, for example, on day 3, I'm very curious about what's going on with FSH, with LH levels. I don't know why recently I've had quite a few of my patients with FSH values well beyond 12, and that's pretty scary when these ladies are in their early 30s. So we can find some good information there. I'm always curious about prolactin. I'm curious about androgen levels. So we associate that more with the male pattern hormones. What's going on there? I won't always do a crazy thorough androgen panel. If there are symptoms that are making me concerned about hyperandrogenism, then I may get a little bit more advanced with that testing. But even for me to just have an understanding of what's going on with testosterone can be really helpful. Estrogen, of course, that's very helpful. If necessary, I shouldn't say it's not necessary because it often is for a lot of people, but doing a day 21 progesterone, or I'm putting day 21 in air quotes for everyone who can't see me right now because not everyone ovulates at the same time. So day 21 is sort of like it's not always the right timing for everybody. So we'll run a luteal phase progesterone at some point based on when we think they might be ovulating. We'll go 7 days after that. And then I think for me, a lot of it comes down to also having a very clear understanding of their metabolic factors as well as their micronutrients. And their hormonal factors beyond the ovarian hormones, I'll say. So what's going on with thyroid? I mean, you and I both know very well how much the thyroid can impact fertility, both conceiving and maintaining. So, and in my fertility practice, I see handfuls of women with elevated thyroid antibodies. So for me, it's natural to just check the entire thyroid pathway. I'm also very curious about what's going on with B12, with ferritin, with vitamin D. I like to know what's going on with blood sugar management. I like to know what's going on with lipid levels. So, it's a lot. it's a lot of testing. So it's always nice if we can, modify it for each individual patient. But that gives you a very thorough sort of look at what I'll assess. Sometimes we'll throw anti-Müllerian hormone in there too, so that we just have an understanding of their ovarian reserve. I'm always really careful with that one though, because it can be scary.
But that's such a stark difference than the kind of routine blood work that women sort of expect to have done when they're 27, right? Like at their physical exam, they may get their iron and B12 levels assessed, their CBC, but they're often not considered to be a strong candidate for having their blood sugar, insulin, triglycerides, cholesterol, vitamin D, right? Like these are like that's casting a wide net for those women beyond what they would like routinely get done as part of their regular health assessment. And yet they're in their prime reproductive years. And that's when we could have a prime conversation about what they want their fertility journey to look like.
Yeah. Yes, absolutely. I personally had to ask my medical doctor to run the tests for me. She was thankfully very willing. However, she told me very frankly, she said, I'll run this for you, but you are handling the results because I don't know what half of these things are. So, right? We have to be very proactive and we have to advocate for ourselves so much. And unfortunately, I shouldn't say unfortunately, because it's not unfortunate, but it often means that you're going outside of the conventional medical system. And so much preconception care falls into the hands of naturopathic doctors. Where it becomes unfortunate is that because we're not an OHIP funded service, it can be expensive for patients. Running blood work is expensive. And when that, yes, sure, we can give requisitions for blood work, but if I'm doing a complete assessment of somebody's fertility, my goodness, it can be like $300 or more when it comes to just the lab testing. So that's frustrating. That's unfortunately not available to everybody, right? So I wish that there was a little bit more going on at the conventional level.
Yeah, I completely agree with you. I mean, it's interesting. If we think about like opportune timing to connect with so many of these couples, that $300 investment in their assessment could change the trajectory of their fertility journey by months, by years, by procedures, right? So, you're right, like there's certainly some privilege and absolute inaccessibility for some couples to not be able to afford to connect with like the out of pocket expense of being well assessed. However, on the flip side, there's so much opportunity there for those couples to, I wouldn't say like get a head start, but really to get a head start, because by the time you'd had those tests done at a conventional fertility clinic, you are months and years and maybe procedures into your journey, right?
Yeah.
Before you may get offered up to do some of that assessment. And what a beautiful opportunity for those people to be able to connect with someone who knows how to use that information before we get there, right? Before things truly are a problem or before they emotionally invest in trying for a year with like blind, right? Like without, I would say like, if we don't do some of that assessment, we're asking me to do my job with my hands tied behind my back, right?
Right.
And how much I would rather couples invest in some assessment versus, supplements or diet plans or whatever it is that we often tend to think about our integrative healthcare as being those things, right? When I think for fertility, the assessment, right, is the actual gold of working with an integrative practitioner.
Mhm. Absolutely, because we have such a wonderful understanding of a wide variety of tests and what is appropriate and necessary for a complete, understanding of somebody's health,
Right.
right? So that's really important. And just going back to the, investing ahead of time conversation, I have seen time and time again the person who has had multiple failed IUIs or has had failed IVF cycles, and then they're winding up in my chair. This is thousands, tens of thousands of dollars that have gone, it's kind of out the window in the sense that these things haven't been successful. And now we're talking about, okay, let's take a full look at what's going on here. and see what we can do. So you can really avoid that in a lot of cases, or even if those situations may be necessary, really enhance their success by doing really good preconception care ahead of time.
So what does the plan kind of look like? 'Cause I think when we think about preconception care, I think the public can probably identify that they need to take a multivitamin, that they maybe want to exercise. There's some okay research out there that most people will take a prenatal, most people will exercise, some people will change their nutrition, some people will, give up alcohol. But it's not this sort of like universal like adoption of healthy habits in those months prior to conception. It's not common or public knowledge what women should do in those months leading up to trying. What are those areas of health that you're working on with women, and are there some simple steps that women can start to look at, like within themselves as part of that preconception sort of even just thinking?
Mhm. So, I mean, it can probably feel a little bit overwhelming because we're really going to want to work on all of their elements of health because we know that sleep can impact fertility outcomes. We know that stress will definitely impact fertility outcomes. We want to have an understanding of what their environmental toxin exposure might be, what's their water intake like, what's going on with digestion in terms of regularity and possible micronutrient absorption difficulties, what's going on with their hormonal function, and how we might work on that with botanical medicines, for example. So we're really affecting many different avenues of their health. So it can often feel a little bit overwhelming to begin with. And just coming back, I should mention to the prenatal piece and the exercise piece, that's just like a whole can of worms in and of itself, right? Because a lot of prenatals are so crummy without the activated folate. And then also exercise is a whole other conversation because we do know from research that there is really an appropriate way to exercise in the preconception period. So we will discuss all of those things. I think if we're talking about making it a little less overwhelming for those who might be listening today, and some things that can be started is first and foremost to get to know yourself very well and to have an understanding of what might be going on with your cycle. Even just to begin with, a little bit of cycle tracking can be really helpful. So using an app, there are so many apps out there. I actually just did a blog post all about all of the fertility applications and devices out there. There are just a slew of them, but even a basic one like Kindara, where you can track the days of your cycle, the cervical mucus patterns that you might be noticing, even your basal body temperature, if you're willing to do that, can give us so much information about what's going on with your cycle. So that's one place to begin for sure. I always encourage women to look into that wonderful book by Toni Weschler, Taking Charge of Your Fertility. It's like an encyclopedia, it looks like when you first get it, but the information in there goes so far beyond what we were taught in health class when we were, 12 years old or whenever it was, when all of us weren't paying attention anyway. It really gives you some amazing information to have a full understanding of your hormones, of your cycle, of what this is all supposed to look like. So I think that's a great place to get started. If of course, we want people to be using a prenatal vitamin. Sometimes a preconception formula is more indicated. So that the decision between which to use is often better had with a professional. But at the very least, we need to make sure that prenatal has a methylated folate in it, and a methylated B12, so that we know that those particular micronutrients are being utilized properly by the body, since so many of us genetically can't do the proper conversions to make those work properly. So that's a very easy thing to do, just to look at your prenatal. And then I suppose the next important thing would be to have some baseline testing done, and that does really involve working with a professional of some kind, whether your medical doctor is willing to get on board, or working with your naturopathic doctor to have an understanding of what could be going on with your hormonal function, with your nutrients, with your metabolic factors. And that can really fine tune the direction that we take when it comes to dietary adjustments, when it comes to understanding what might be necessary with respect to clinical supplementation or botanical medicines that might be effective. And then we can also, dive into the important lifestyle factors like sleep and stress and exercise and hydration.
hmm I mean, I think what I'm hearing there is that the strategy really should come from that information gathering, right? And so coming back to that idea, like, and you're right, like if we lay it all out like this, like smorgasbord of options, that is an overwhelming, daunting task for women to take on. And I'm always cautious that I don't want women to bear 100% of the emotional responsibility of their fertility journey, because they do have a partner that's part of this process with them. But I think, knowing where to start and knowing what the priorities are, and is that woman's priority hydration or stress, or is it nutrition or supplementation? That's really where that expertise comes from working with someone like you, right? Who has that ability to distill it down and say, based on your history, based on your lab tests, and based on your goals, this is how we're going to approach it, right? This is the amount of time we should expect it to take for us to see some evolution, and also to co-advocate for those women to get the care they want, right? I'm sure you've had this experience where women sit down and they say, well, I would really like to avoid fertility care. And after reviewing their case, you say, no, like you need to do fertility care today, right? Because they don't have that person that's on their team that's giving them this feeling of being heard and listened to, but then also providing information that they can trust around what their best course of action is.
Yeah. Unfortunately, I had that conversation about a week ago with a patient where I just said, like, we have to get moving here. And no one had had that conversation with her before. It can be, I find being an advocate for my patients is a huge part of the work that I do, and giving them a clear and concise action plan so that they know exactly what they need to be doing to have optimal outcomes.
And the side effect of doing all of these things, right, is that they feel better.
Yeah. Yeah, absolutely.
What do you notice with these women? Like, I mean, because they can't help but feel better, right, when they're working on all of these things.
Yeah, right. And that is another important piece. And I often will have that conversations with patients, is we're not just talking about, getting pregnant. This is also maintaining the pregnancy, having a healthy pregnancy, being healthy after the pregnancy so that you can be around for your child's life, right? So, it really goes beyond this preconception window. I often say, though, essentially we're like bodybuilders when we're trying to conceive, right? That's what we're becoming. We're becoming bodybuilders. And okay, so this is maybe a little bit personal in the sense that I come from a bodybuilding family. So I know the work that bodybuilders do. I mean, these people eat all day long. They work very hard to get their body into tip-top shape. And it's really the same for us. We're working very hard to get our bodies into tip-top shape so that we can grow a human being, so we can actually truly build a body. So of course,
I love this.
Yeah. So of course, this is going to impact our overall health in every possible way. So I see women who are losing weight that they've never been able to lose before. I see women who are losing, if we're talking about a PCOS population, the acne is clearing up, their skin has never looked better. Their energy is so much better. Their bowels are functioning regularly. They feel like, normal. They've been living with all of these things that they thought were normal, but now they're like, oh, this is how I'm supposed to feel? Amazing. Sign me up.
Yeah, it's tough because with fertility, like there's so many things in medicine that are on some kind of like scale, right? Like, is your pain a 10 out of 10? Is it 8 out of 10? Is it 4 out of 10? Is it 2 out of 10? When we talk infertility, we're often talking about a very dichotomous experience, right? Did we get pregnant or no? Did we have the baby or no, right? It's yes or no. And I love that idea that we need to help encourage women to think about their fertility journey as being much more on a bit of a process and having a rating scale to their symptoms that are going to lead us to that yes, right? But I think we often in that process of women trying to feel better or work on their fertility, I should say, almost ignore the fact that they feel better, right? Because they all wanted to be pregnant yesterday. And when we come into the situation and say, like, we're going to take a minute here or 3 months and work deeply on some preconception care, as they're feeling better, but not pregnant yet, right? That can feel like we're not meeting the mark. And yet we can say to those patients, well, what about your cramps? And they're like, well, those are better, right? But I still didn't get pregnant. And I say, well, what about your energy? No, it's better. And I'm not having to nap in the afternoon, but I'm still not pregnant, right? And that we forget that, or that mindset is so yes or no, right? Again, because we have that expectation that things are going to happen like the instant we're ready to try, that those women need to go through a little bit of a process of healing themselves and healing their symptoms before, and then all of a sudden, then it does happen for them, right? It's not until they have less pelvic pain and they have better energy and they have more regular cycles that it does become easier for them.
Yes, absolutely. And, we're talking about a patient population who are fantastically compliant. I
Yeah.
mean, sometimes these women are on a lot. They're taking a lot of supplements to fix all the things that we need to fix. We're asking a lot in terms of lifestyle changes and that type of thing, but so compliant. You're so right, though, that we often will forget about all of the other benefits that they're getting from this until they have the baby in their arms. So I try to keep patients aware of that as we go through the journey and asking them about some of the symptoms that they were complaining about initially. Definitely migraines being one of them too, right?
Mm-hmm. So what's your big message for women, Rachel? Like if you think about like what your passion is around this topic, like where you want to see the future of this part of medicine go and what you want women to know about preconception care, like what's that sort of soapbox speech if you were going to impact our listeners' lives and change the way they think about preconception care, what would you share?
I think that what I would want to share is that it's not really an option. This is something that we have to do. Most of us aren't doing it, but we need to do it because we're not just talking about ourselves here. Because we are working to create another human being, all of these adjustments are going to impact that human being's future life and health and how they contribute to society and therefore the future of our entire world. So it's a very selfless situation, although you will find a lot of benefit personally. It goes so far beyond that it becomes really a non-option. And that is what truly dawned on me when I was going through my own struggles, that no, this has to happen and really everyone should be doing this.
Amazing. How can our listeners get in touch with you? I know you have lots of, wonderful insight. You share so much through social media. You have some content that our listeners can download to access some of your tips and ideas. Where can they reach you?
So definitely on Instagram. My handle, I think, will be shared below the
Yep.
chat today. But for anyone who's like listening and wanting to check at the same time, it's Dr._Rachel_ND. So I do spend a lot of time on there. I also have a download. A lot of the things that we talked about today in terms of things that you can do so you don't have to wait a year can be accessed via my website. So basically, as soon as you go to my website, which is rachelcoradeddy.com, I'm very sorry, my name is very long, will be right there. It'll pop up right away. So I'm sure that'll be included in the show notes so you don't have to try to guess how to spell my name. So that is another place. I do have a private Facebook group too, where I will share content and have conversations with women who are in their trying to conceive journey and in their preconception journey. So that's an option to find me and join me in the social world.
Thank you. And thank you so much for spending time with me. And I think one thing we didn't totally talk about is the fact that we work together.
Oh, yes. Yes, we do.
So, which you've been this wonderful addition to our clinical practice because we work with so many women in that preconception, fertility, miscarriage, and hormone side of women's health. It's been such a great, opportunity and option for our patients to be able to work with both of us on that preconception care. And so that's also another way that women can connect with you, which I think we totally missed chatting about throughout. But we do have this like luxury of working together, which has been so great. And so thank you so much for spending the time with me today, Rachel. We'll put all the links for how people can get to know you more and access more of your information in the show notes.
Excellent. Thank you so much for having me. I really love being asked to provide some information for your wonderful audience.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.